Thank you for staying with us. India's health ministry reports another daily record of over 90,000 coronavirus cases, bringing the country's total confirmed cases to over 4.2 million. This is just as the world's coronavirus cases hit over 27 million. And here are details with Justin Bem-Unyi.
India, home of the world's fastest growing coronavirus outbreak, has surpassed Brazil to become the country with the second highest number of cases. On Monday, India reported 90,802 new infections, breaking its own record from the day before and taking its total to more than 4.2 million, according to a New York Times database. Brazil is now third with more than 4.1 million cases. In the meantime, colleges and universities are taking hard-nosed steps to curtail the spread of the novel coronavirus and prevent campuses from becoming the latest COVID-19 hotspots. More than 20 New York University students have been suspended for violating COVID-19 conscious safety protocols, while Boston's Northeastern University has dismissed 11 students for defying the orders and plans to keep their tuition. Meanwhile, reports have it that about 150 cases of COVID-19 can be linked back to an indoor wedding ceremony and reception that took place August 7 in Millinocket, Maine. Approximately 65 people attended the August 7th wedding. In other news, China has put its homegrown coronavirus vaccines on display for the first time, as the country where the contagion was discovered looks to shape the narrative surrounding the pandemic. High hopes hang on the small vials of liquid on show at a Beijing trade fair this week. Now let's take a look at the numbers from where globally, as at 6 p.m. on Monday, Worldometer statistics indicated 27,354,539 confirmed coronavirus cases, of which 19,424,007 are recoveries and 894,385 deaths. From Africa, 1,301,103 cases have been confirmed, with 1,036,422 recoveries and 31,320 deaths. Out of these numbers, Nigeria has recorded 55,005 cases that come with 43,013 recoveries and 1,057 deaths. And this is where the update on the global pandemic ends. Thanks for watching.
Thank you, Justin. Now let's take a look at Nigeria. We have in our studio founder and chief executive officer of In-Country Medicare, Dr. John Tor-Agbidye, to speak on the current COVID-19 situation in the country. You're welcome, Dr. John.
Thank you very much. As we've just heard on the news, we have a second wave in some countries. We've heard about the case of India, then you're talking about Brazil.
Yeah, now we're going to talk about Nigeria.
Yes.
Now, in recent weeks, there has been a decline in number of COVID-19 cases in the country. Does that mean that the virus is out of the country, or we are not doing something?
It doesn't mean that the virus is actually out of the country. We should not rest on our own laurels. This is to say that for a number of reasons, the second wave is bound to occur, as we've seen. And this is for several reasons, including either the lockdown is when it is uplifted too early, it exposes, the population for coming down with the disease. Then a new mutant strain of the virus can also come up that it is more deadly. And we've seen this all over the world. It has been reported. As of this time that we're talking, there is no definite treatment for the virus. Neither have we developed a vaccine that is actually made, public. This actually exposes us to the fact that we've not developed the appropriate herd immunity. WHO reported that less than 10% of the world population has developed immunity against the disease, and Nigeria is not an exception. So we should be prepared. How do we get prepared? There must be a robust and higher increase in the numbers of testing, as well as contact tracing. These are very critical. These are steps that we must embark on. As I'm talking, I'm not sure we have attained that level.
So what you're saying, Doctor, what you're saying is that a second attack is imminent. Another wave is imminent.
No doubt about that. I've
so
already told
why
you.
Must we be very, very worried?
Yeah, we should be concerned. And up to now, you see that the non-pharmaceutical interventions, as well as public health measures, are not being strictly adhered to. You find people going to high-risk areas where the population is actually dense, like the market. They don't feel like wearing their own mask. These are things we should. Then over time, I think we have also getting relaxed with measures like washing of hands, using the appropriate hand sanitizers. People are going back to this. You'll be surprised if you go to some public places. There is total non-adherence to these non-pharmaceutical interventions, which is key to actually slowing down or preventing us from getting into the second wave. And Nigerians must take this serious. I'm not a prophet of doom, but we must be up and running in adhering to non-pharmaceutical interventions.
So I wanted to ask you, should we maintain the COVID-19 protocols, or should we loosen our guards?
Very much so. We should maintain them, and this is this is the strong message. We should maintain them. In addition to maintaining those, I'm also out to say here again, the best way that our body gets protected from any disease is our immune system. People should be more encouraged. People should all invest in getting the appropriate immune boosters, things like vitamin C.
And what do you have to say about testing, sir?
Testing, I said that we need to up-regulate. We need a robust testing, system. I don't know the exact numbers, but a country like ours, we should be talking of testing over 100,000 a day.
Thank you very much. Thank you very much, Dr. John Tor-Agbidye, founder and chief executive of In-Country Medicare, for talking to us.
It's my pleasure. Thank you.